All righty. Hello, everyone. Welcome to our first Project Echo of 2025. We hope your new year is going well. We did just start with a new Project Echo platform, and we hope that we're so glad you're here and were able to register and get to us. And we're very excited about our Project Echo today. This is our Project Echo. It's based on the best practices of aging care. And if you haven't subscribed to our email list, there is that QR code that you can go on and do and just open up your camera and it'll get you going to the list. This particular Project Echo is in partnership with the University of Louisville Trager Institute and the Kentucky Coalition for Healthy Communities. And we are here to help you engage with our Project Echo. So we ask if you're able to go on and turn on your video camera. And we do ask that you go on and mute yourself. But if you have a comment or a question, you can do that in a variety of ways. You can raise your hand, you can chat, or you can unmute yourself. If you are having difficulty with your sound or your video, there's a way to go on and click on your little arrow in your screen and go on and test your microphone and your system. And if you get disconnected, you can always join by phone. It is on the agenda or in the system to tell you how to join us via the iEcho system, how to join us via the phone. So we ask that you go on and add your name and your organization to your video square. I have yet to do that. So I'm going to go on and click on my video square in the upper right-hand corner, go on and click on name, and then I'm going to go on and add my organization next to my name. There we go. Sorry, guys, I should have done that already. There are two ways to go on and do this. You can also do this by going on and clicking into the participants and then going to the far right. And you can click on more and click on rename and go on and put your name in there and your organization. It just helps with becoming a community, a learning community. So if you are unfamiliar with the University of Louisville Trager Institute, our mission is to help individuals optimally age throughout their lifespan. We are a workforce development hub. We have several grants from HRSA that helps us become a workforce development hub in which we are actually training a variety of different disciplines in how to help other individuals become optimal aging experts. So we also are a practice transformation hub in the sense that we're helping different clinics and emergency departments and nursing homes and a variety of other traditional and non-traditional primary care sites to be transformed in order to help individuals optimally age. And we also try to transform our communities in a way to help us all optimally age. This Project Echo is in collaboration with the Kentucky Coalition for Healthy Communities, and I am going to go on and see if our colleague Mona Huff can introduce a little bit about the Kentucky Coalition for Healthy Communities.
Thank you, Pam. Yes, welcome everybody to the ECHO and the Kentucky Coalition for Healthy Communities meeting. And the year 2025 is the year to thrive. So we want to find different ways that we can help our communities, ourselves, our families to do that. So what we hope to do is to create community support systems for older adults and partnerships with the existing local coalitions and organizations right in their own communities. We also want to develop the workforce and concerned community members to empower our communities to become healthier. And you'll hear a little more at the end of this meeting how you can do that. So thank you again for being here.
Thanks, Mona. If you're unfamiliar with the term age-friendly healthcare system, this was developed by IHI and John A. Hartford Foundation. It's been around for several years, and the focus is on trying to basically transform our practice environments, that we focus on the 4 M's of age-friendly healthcare systems. What matters most to the individual, trying to make sure that we always ask what matters most and think about how it is that we work with our patients in a way that really honors what matters most. We also want to look at mobility and help our individuals to make sure that they have mobility goals and see how we can help them achieve those mobility goals. looking at medication, making sure that the medication, there's a reason for that medication, that the medications are interfering with one another and that they're not on high risk medications and that that medication doesn't interfere with what matters most to that individual. And mentation is just a word for mind and mood. So looking at a variety of things, including individuals' cognitive well-being, looking at their mental well-being, looking at things like depression and delirium and dementia. So age-friendly healthcare system, it teaches us to be able to be focused on these 4 M's as we provide care to individuals that have an interest in optimal aging. So our 2025 schedule, we began our Project Echo back in November. I know that some of you guys were with us. We continue this particular series of our Project Echo for the year. Today, we're going to be focusing on moving to thrive, the power of physical activity and health. In February, we're going to be focusing on advanced care planning, and then we're going to be focusing on March on restorative sleep. What our Project Echo does is it focuses on a variety of things. We just introduced you to the 4 M's. It also has a lifestyle medicine filter. And every other month, what we're doing is we're focusing on our lifestyle medicine. And then the other months, we're infusing other topics that were of interest to our Project Echo community. So there is a way to go on and register for all of the sessions, and you can go on and use that QR code right there on the lower left-hand corner to go on and register for all of them. And if you're unfamiliar with Project Echo, Project Echo's been around for about 17 years. It was developed by Sanji Arora. He's an MD and his focus is on hepatitis. And there were patients that were coming to him and driving 200 and 300 miles. And he didn't feel like he just wasn't, increasing capacity to be able to see his patients. All he was doing was taking one office visit away from another individual. So he basically thought he really needed to create local capacity. So he developed this platform called the Project Echo platform, and it's a telementoring platform. And the idea is not to move patients, but to move knowledge and to build capacity at a local level. And so to every Project Echo across the world, as there are Project Echoes across the world, there is a focus on case-based learning. Usually there's a didactic, there's usually a presenter, then there's a case, and then there's a teach-all, learn-all component per Project Echoes. And our Project Echoes, we're trying to focus on the best practices in interdisciplinary team-based care, focusing on optimal aging. So if you're interested in receiving an attendance certificate, we can make sure that we get that certificate to you for the hour and a half for today's session. You go on and complete the evaluation at the end of the session, and our community health workers that are looking for CEUs, you must complete the evaluation at the end of our session in order to receive that certificate. And today's presenter has nothing to disclose. And again, we wanted to let you know that this particular session has been approved by the Kentucky Office of Community Health Workers for our community health workers to provide that 1.5 CEUs to you, to certified community health workers. All right, for our presentation today, we have Kristen Neises, who is presenting on Move to Thrive, the power of physical activity in health. And let me just tell you a little bit about Kristen. Kristen Neises is a board-certified nurse practitioner and a lifestyle medicine professional specializing in geriatrics and whole-person health care. She serves as faculty at the University of Louisville School of Nursing and the Trager Institute, where she's dedicated to advancing holistic care for older adults. And through her Geriatric Academic Career Award, otherwise as GACA, referred to as GACA project, Kristen leads initiatives to integrate lifestyle medicine principles into education and practice, equipping healthcare professionals with tools to improve the health and the well-being of older adults. Her work emphasizes an interdisciplinary approach, ensuring comprehensive age-friendly care. Outside of work, Kristen enjoys spending time with her husband, her dog, and her family. She loves practicing yoga, running, cooking, reading, and exploring new destinations through travel. So thank you, Kristen. Where is Kristen? There she is. All right. Hi there. So we're so glad to have you. And it's a great, to think of January as a good time to think about physical activity. Can't really do it outside. Got to get rid of that snow, but
A little dangerous outside right now. Yes, thank you so much for the introduction, and thank you all for being here today. So, like Mona said, 2025 is the year to thrive. And so I'm going to talk about moving to thrive and really the power that movement has in health for older adults. Our objectives for the day, I hope that you'll be able to recall the recommended national guidelines for physical activity for older adults specifically, including specific recommendations for movement frequency, duration, and intensity. And then apply practical strategies to integrate movement throughout the day for older adults, reducing that sedentary time and promoting a culture of consistent, accessible physical activity. And lastly, I hope you'll be able to analyze some of the common barriers to physical activity for older adults and look at developing some solutions that encourage that movement and support physical and mental well-being. Right, let's talk about why physical activity matters so much for older adults. There are some immediate benefits. So getting active can immediately improve sleep, reduce anxiety, and lower blood pressure, and also boost immune function. Even in the short term, activity can do that. And then over time, regular physical activity can provide some long-term benefits, like lowering the risk for dementia and depression, reducing the risk of chronic diseases like heart disease, stroke, type 2 diabetes, and even lowering the risk for developing some types of cancer. And it also helps older adults maintain their independence. It improves their bone health and reduces the risk of falls. And so this graphic shows how even some small actions can lead to some significant improvements in the short and long term. Something as simple as a 20-minute walk can have a powerful impact on sleep and mood. And then I want to point out specifically some of the mental health benefits of physical activity. This graphic shows how regular exercise can really support emotional and psychological well-being. For example, physical activity can reduce feelings of depression and stress by releasing some of the feel-good hormones, endorphins. And it also enhances mood, boosting the overall emotional well-being. And exercise doesn't just make you feel better temporarily, it can help improve the long-term mental resilience by increasing your energy levels and promoting better sleep. And so when older adults sleep well and they have more energy, they're more likely to engage in meaningful activities, which further supports their emotional and physical health. And then additionally, recent research has shown us that certain habits may actually slow down the biological aging and support overall health. Some studies show that daily physical activity can lower your cognitive age, while strength training is linked to healthier cells in your body and, again, a reduced biological age. So how much activity do we need, and what kind of activity? This graphic looks at the National Physical Guidelines for older adults specifically. As you can see, it recommends at least 150 minutes per week of moderate intensity activity. And this can include something as simple as brisk walking, or 75 minutes of vigorous activity. So moderate intensity activity is anything that gets your heart beating a little faster. And a simple way that one can measure this is by the talk test. So during that exercise, the moderate intensity exercise, you should be able to talk in sentences, but not sing. So that's a simple way to measure. And then the guidelines also highlight the importance of muscle strengthening activities on at least 2 days a week, as well as incorporating balance exercises to prevent falls. So examples of these are Tai Chi, dancing, yoga. And so these guidelines may seem daunting at first for some individuals, but they really are achievable with gradual progress and consistency. So the key is really to encourage activities that match each person's abilities and their preferences as well. All right, so speaking of brisk walking as a moderate intensity activity, Mona recently sent me this great resource, and it lists 100 reasons to walk. There is, I believe everybody will get a copy of the press or be able to access the presentation. There is a clickable link on there to this site. So Walk with a Doc is a national program where healthcare providers lead these free community-based walking events, and the goal is to promote health and wellness. And they're available in many areas. So this program highlights why walking is such a valuable form of exercise. And this link gives us 100 reasons why it's helpful. And what's nice is there's links for each reason to the evidence behind it, if there's any other scientific people out there like me. So some of those benefits include lowering the bad cholesterol, improving your cardiovascular health, reducing the risk of stroke, and like we mentioned with activity, boosting mood and cognitive health. So you can explore that full list of benefits if you'd like. All right, in addition to meeting the recommended activity levels, it's equally important to address sedentary time. So that's when we're sitting for long periods of time, whether it's sitting on the couch watching TV or working at a desk for long hours. That sedentary time is associated with higher risk of heart disease, diabetes, type 2 diabetes, and premature death. So encouraging older adults to break up those long periods of sitting with some light activity, whether it's standing during phone calls or getting up and marching during commercial breaks. Those small periods of activities, like to call them activity snaps, they can make a really big difference. So just small changes can add up to big health benefits. And a lot of people think that they can, if they go and exercise, go to the gym or whatever their exercise is, then that is good enough because it meets the guidelines. But what a lot of research now shows us is that that's not enough. We need to make sure that we don't have long periods of sitting. So now let's talk about some practical strategies for integrating movement into daily routines. Whether we're incorporating simple morning stretches or light walks during the breaks, they can add up to meet the activity goals. And under the category of social connection, there's programs like Silver Sneakers that offer free fitness classes for older adults that combine exercise and community. And I recently went onto the website and was very surprised at how many programs there are at different facilities all over. And there are even some options for online programs if they're unable to make it to a center. Another great resource in the Jefferson County area is the Jewish Trager Center. They host wellness events and group activities to promote active lifestyles and social engagement. And there's a lot of different programs like these in different communities. So that's something to explore. By participating in these programs, the older adults can benefit from both the physical activity, but also the sense of community and social connection, which is also linked to longevity. And it also helps them sustain the long-term adherence to their exercise routines. We have to discuss some of the common barriers that older adults face when they're trying to stay active. First, we have physical barriers. So chronic pain, mobility issues can obviously make it very difficult to exercise. Then there's environmental barriers such as unsafe walking areas or weather, like the ice that's covering our grounds, can really limit their outdoor activity and not to mention increase their risk for falls, leading to a lot of other problems. Next, we have social barriers like a lack of support or motivation, and psychological barriers such as fear of falling or low confidence can also play a role. So by understanding these challenges, we can work to develop some solutions that address each individual's needs and help them stay active. So now that we've identified some of those common barriers, let's look at some realistic and compassionate ways that we can help them overcome those barriers. First, personalized plans are key. Meeting people where they are, tailoring their activities to their abilities and also their interests. That makes it more likely that they'll stick with it. And then accessible options such as chair yoga or simple strength exercises with wristbands make movement achievable, even for those who have mobility challenges or even transportation challenges, finding accessible options that they can do at home safely. And then community resources, like I mentioned, the Silver Sneakers classes or other group activities at local wellness centers can provide the structure and the social support. And then education plays a huge role, helping them understand that even the small steps count and can give them a lot of benefits. It can alleviate some of that fear of failure. So any step forward is going to make an impact. And then finally, having a support system, whether it's family, friends, a walking group, a medical team, can really provide the motivation and encouragement that's needed to keep moving forward. So when we approach these solutions with empathy, we really empower them to take control of their health in ways that feel manageable and rewarding as well. So one tool that I think is really helpful, an easy tool, is the Move Your Way activity planner. So when helping them, older adults, create an age-appropriate exercise plan, movement plan, we want to use tools that really simplify the process and also provide support. So I think this planner is a great resource. It helps to track their progress. You can set reminders, and then you can adjust goals to fit individual lifestyles. It has questions about, what do you like to do? Do you like to garden? Do you like to dance? So really able to tailor that plan. And then setting realistic, personalized goals encourages consistency, and meeting those small goals can really help them build their confidence. And then they can make adjustments as needed, such as modifying their plans for health setbacks or whatever the case. And then working with the healthcare providers or community organization ensures that there's some guidance and encouragement along the way. So we can really prioritize collaboration and flexibility so that we can create plans that truly do help them thrive. Right. So that was a lot of information, but if you take anything away today, I hope that you take away that regular, consistent physical activity really supports both physical and mental health. And I hope you have found some ways that movement can be integrated easily into daily life, just with some simple adjustments. And then by overcoming barriers, or to overcome barriers, rather, it requires a very personalized, tailored plan. And just small, consistent changes can really lead to some meaningful benefits. There's some references and resources here for you all. And here is my contact information next. All right, are there any questions?
Thank you so much. Are there any questions or comments for Kristen? Justin, could you go back one slide? Kristen, I was noticing on the Silver Sneakers. So if individuals were interested in finding where the Silver Sneakers is located, would this site provide those locations?
I believe that, yes, that is the home for Silver Sneakers, and you can just put in an address. And when I put in my address, there were so many,
right,
just in the city, but in the rural areas as well.
Yeah. Any questions? What is oh, there's a question here from Mohammed. Let's see. What is the minimum duration of walking?
Yeah, so the national guidelines, and this is for all adults, recommends 150 minutes per week of brisk walking would count. And so that can be split up into 30 minutes 5 times a day, or 10 minutes each, or 3 times a day, Monday through Friday, or whatever way you want to break that up, but meeting that minimum guideline. And the more that you have, there are added benefits to the more, but these are the minimum.
And then Bev commented that many insurance companies include Silver Sneakers as a benefit. That is correct.
Yeah, and that that website, the Silver Sneakers website listed on that slide, I believe you can go in and put in your information to see if you do qualify, but most of it, from what I understand, like Medicare and a lot of insurance companies do cover the cost of Silver Sneakers.
Any other comments? Kristen, I'm glad you talked about the small steps. Sometimes, even those of us who really are engaged in exercise, sometimes, life gets so intense and it takes you away from your exercise goals. And then it just seems so daunting to get back to those original exercise goals. So just even those, ideas of just, dancing while cooking, or just walking in place. I think those things can help you, break down the barrier of I'm never going to get back to that ability right now in my life. So that was something that, resonated with me.
I agree, Pam. And there is research that says even as little as 7 minutes can help us. So, a lot of times a doctor will say, I want you to get 150 minutes. And you kind of laugh and think, yeah, sure. Or not 150, 150. Yeah. So the small steps that Kristen talked about, whether it's just walking during a commercial or standing at your kitchen sink, holding on and walking in place until you build up some stamina. And then, gradually reach that goal. And you can do it if you do it that way. But if you try to do it right in the very beginning, often you'll get discouraged. So it's important to listen to what she said when she said small steps count and you can add to them.
Yes. You know, I've talked to some folks in my family and some neighbors, and they said that sometimes they're just embarrassed to walk into a gym because they don't have the stamina, and they're just overwhelmed with all these people around them that are seem to be so fit. So, you know, those types of things, those small steps of getting you, you know, just comfortable with your body and, you know, setting those small goals and then being able to, you know, progressively move so that you can then get into, you know, if your goal is to go to the gym, then, you know, those types of things would help you. And Bev says that the YMCA has senior programs as well. Yeah. Any other comments that folks have regarding their own exercise plans? Anything else? Okay, well, I think this is great. I think it's going to really help us as we think about our case that's going to be presented by Justin. So thank you, Kristen. I hope you can stay around. And yes, you can. Okay, great. All
Yeah.
right. So we have a case presentation, and I believe that our own Justin Magnuson is going to go on and present the case.
Thank you. Thank you, Pam. So I am presenting this case on behalf of Naomi Deeds, one of our professional interns who could not be here today. So I'm really appreciative to her for the opportunity to present this case, and I hope you all have some good suggestions. So quick overview, the patient is a 69-year-old Caucasian woman. Her husband of 40 years died 3 years ago, and she moved to Louisville to be closer to her sisters. She reports struggling with grief over the loss of her husband and her parents, who passed away shortly before her husband. She reports a lack of desire to engage in social activities and a lack of motivation to try new things. So the first main question is ideas to increase physical activity, possibly paired with social engagement. And question 2 is ideas to help the patient work towards healthier food options. So she has adjustment disorder with mixed anxiety and depressed mood, generalized anxiety disorder, chronic depression, prolonged grief disorder, obesity, and osteoarthritis of knee and hand. She's 5'4", 241 pounds. Her BMI is 41.37. Her blood pressure is 110/70. Her LDL is 90, HDL is 64, and her A1C is 14.5. So she reports symptoms of depression, primarily a lack of desire to do things. She's frustrated that she is still, and I'm saying this in air quotes, grieving the loss of her husband. She shared she has connections in Louisville from when she grew up, but she is not ready to reach out to them yet. And she reports feeling exhausted and overwhelmed by social activities. The patient is financially stable and has advanced directives. She has her own transportation and is not at risk of experiencing food or housing instability. She lives in an apartment with her dog. Again, she lost her husband. Her parents passed away shortly before he did. She's relocated here to be near her sisters. She supports her sisters who are deaf with their caregiving needs as they and their husbands are aging. She does not currently work, but has worked as a caregiver in the past and reports finding purpose in caregiving. She has no history of substance misuse. She reports having a drink 2 or 3 times a year, and she quit smoking 15 years ago. She is not currently physically active. She's wanting to go to the gym with her sister, but the weather has delayed those plans. She does have a small dog that helps get her out of the house throughout the day, but she does not go for long walks with the dog. She is adhering to her medications. She admits to eating too much sugar and has been working to reduce the amount of sugar she consumes. She receives annual physicals and has support is receiving support with managing her psychiatric medications. She reports having doctors she loved in her home state that she has seen for over 20 years. Since moving to Louisville, she has been working to establish a team of physicians to support her as she ages. She reports satisfaction with her current physicians and shared a feeling confident in advocating for herself and her healthcare needs and concerns when necessary. She's not at risk of falls in her home. She's well groomed, appropriate in appearance, tone, eye contact, and mannerisms. The patient's home appears clean and well kept. does not report high levels of stress associated with herself or her home environment. She does report occasional stress associated with the caregiving she provides to her sisters and their husbands. She has a primary care provider, an orthopedic surgeon, a social worker in behavioral health, a student therapist, a psychiatrist, and an OBGYN. This is an overview of her medications. I did present these to Dr. Dimitra Antimasiris, and I will follow up when we have the case discussion around Dr. D's suggestions, but she is on, I will butcher these, so I will spare us all, but this is the first page. And the second page of her medications. Dr. D did have some minor concerns about her psychiatric medications, but she suggested that we follow up with a psychiatrist to talk further about that because that's outside of D's comfort level of discussing any changes. But just a few reminders. Again, her husband of over 40 years died 3 years ago. She's struggling with grief. And then she reports the lack of desire to engage in social activities and the lack of motivation to try new things. So really looking for ideas to increase physical activity paired with social engagement and to help her work towards healthier food options. So I will stop sharing.
Thank you. Thank you so much for presenting that. So any initial thoughts?
Justin, if the 14.5 is an accurate A1C level, and I would probably yield to Kristen to talk about this even more, but I know when we used to do our diabetes mentoring, if their blood sugar was too high, we wouldn't want them to walk right then. So it seems to me that she needs to be working really closely with her endocrinologist and her nutritionist to bring that down before she can really do some exercise. And at that rate, I imagine she's so tired that she can't move. And I'll be quiet because that's probably all I need to say.
And Mona, that caught my eye as well. So I'm definitely making a note here about her A1C to see if that's accurate. And I'm seeing some comments in the chat. Grief support, that was something that really jumped out at me too, Alexis. And Brenda, I will definitely ask about that or suggest that to Naomi. She is seeing a student therapist. And so I'm seeing Amanda's comment about what types of things did she enjoy prior to moving to Kentucky and prior to her husband's passing. Amanda, I think there could be some really good strategies to look for motivational things that she's done in the past.
Justin, I noticed that you said that she's overwhelmed in social activities.
So it says that she's overwhelmed and doesn't want to engage in new social activities.
So you wonder if the overwhelm is, is it a function of being around too many people? It's too noisy. I also know she said that her sisters are deaf. So you wonder what kind of interactions make her feel safe and not overwhelmed that could, tap into her interest to move more after all of the things that Mona indicated needs to be really investigated. Because that might, there might be things that, the small steps that Kristen was talking about, but clearly there's a lot of barriers, or challenges. I think Kristen talked about the physical. There was cold weather affecting her ability. There was some physical osteoarthritis. I couldn't tell if there were some pain. Was she on pain meds? Did anybody notice that in the list?
So I can go back to the list. I think that Dr. D did talk about potential pain medication.
She's on Flexeril, at least a muscle relaxer. What do you want to call that?
I think she was also on meloxicam, which
Yeah, yes, that's both ibuprofen and meloxicam.
That's right.
Yeah, and Dr. D had made some suggestions about concerns about her kidneys over time.
Oh, yes. The ibuprofen. Better to move to Tylenol. Is that what you think she's thinking, Kristen?
Yeah.
Okay.
And truly, I mean, her A1C is so high, that is very hard on the kidneys as well. So I would be concerned about, I think that would be a priority. I had a question, and I'm sorry if I missed this. Does she have any issues with food insecurity?
So it said that she wasn't at risk of housing or food insecurity.
Okay.
So Tiffany's asking, are you aware of how active her sisters are, and would they be willing to join in activities with her? Tiffany, I think that's a great question.
You did indicate she wanted to go to the gym with her sister, right? But the weather
Yes.
precluded her from getting there. So there is interest in there.
Justin, I'm going to post in the chat some information. I don't know if she's already established at a gym, but I recently spoke with the director of the senior program at the Jewish Louisville Center. And she gave me a lot of really great information on their activities. And they also help with counseling and food pantry, and that's probably not going to be an issue with her, or well, at least the food pantry. But they also have like special lunches and different things like that. So a lot of really good resources there that I'll post in the chat.
And is that the Jewish Community Center?
It is, yes.
And I know that they have a senior program because we had reached out to them about a program we did last year, and they were in transition with their leadership at that time. But that's a great suggestion.
I wonder if she might want to start with some online exercise, classes or videos, and we used to have an online Tai Chi, for some slow movement type type exercises. Chair yoga, someone said.
And yeah, so we still have the virtual Tai Chi classes, so I can add that as well.
Lynn, would you like to jump on and share your comment? You guys have got some great comments. Zendia, would you like to share your comment?
Yes, I was given the recommendation of if she's insulin dependent, like these, I don't want to call it a trend that's coming, but like these Wegovy and semaglutide, and she's insulin dependent, maybe changing her medication to one that's serves as an appetite depressant.
Good point.
Yes, from what I hear, like anytime you eat any kind of junk food, you immediately almost feel nauseous. So it kind of curves your mind, like, do I really want this, candy bar? Because I know I'm going to feel nauseous afterwards. So maybe that can be a motivator for her. But of course, that would have to be with someone who knows about the medicine and stuff. So that was one of the recommendations I had.
Thank you.
Of course.
And Lynn indicated she's having audio problems. When she goes to the grocery store, she could push the cart around and walk around the store to get a few extra steps in. Kristen, when you presented in, I think it was November, you may have touched on things related to sugar cravings, and I don't know, I can't remember if you did or not. So someone that is craving that kind of food? What suggestions do you have for things that are, considered junk or highly processed food? How to help someone?
Well, I mean, that's a really hard one. I think in cases like this, those medications can help with some of that food noise. Um, I think that a lot of times it is an emotional concern that needs to be addressed, and that can be done through therapy and meditation. Some people have success with you know intentional eating. So you have a moment where you're craving this type of food, and before doing that, stopping, asking yourself what's going on. Is there something going on emotionally? How am I feeling? And then taking a step back and saying, okay, well, let me drink this glass of water. Let me have this plate of something else that's nourishing. And like, even if it's just a few carrots or something like that. Sometimes that can be helpful, but oftentimes it's a deeper emotional thing that needs to be addressed.
Yes.
And then I think also just finding alternatives. So if there's something that you like, I love Almond Joy candy bars, but they're full of sugar and calories, and so I found some almonds that are cocoa flavored, and then there's some that are coconut. And so, I mean, it's obviously not the same, but it helps kind of curb that appetite by finding some alternatives that I still really enjoy.
Thank you. All right, we're gonna go to Shane and then we'll go back to chat. Shane, did you want to share something? Oh no, we can't hear you. Is your audio not working?
Sorry about that.
There you go.
Yeah,
Thank you.
thanks to everyone who's presented. I was just going to bounce a thought off of what I heard Kristen said, talking about a lot of times there's this deeper emotional trigger that for me, from my experiences, I'll just speak as a person in recovery. What I've found is that I'll try to replace an old, vice with sugary stuff, which is it's just like a drug. I mean, it's a white powdery substance too, wouldn't you know? But the farther I'm, just like drugs and alcohol, what I've found is the farther removed I am from them, the less I crave it. And sugar is the exact same for me. If I'm eating it every day, I want it. And then if I can string together, 3 days of not eating sugary cereal or just a candy bar, it wouldn't, it slowly starts to go away, and I just don't want it as much. It's a lot easier said than done, but it's,
Yeah.
It just came up.
Thank you. Thank you for sharing.
Those are very deep insights and so very true. But one thing that I have noticed especially when I was first diagnosed with diabetes and my A1C was so high, I crave sugar, something awful. So we really have to get her blood sugar under control before we can expect much success from her, because it's almost like a drive that you have to have when your blood sugar's that high.
Yeah.
I wondered, so she's outside of the window to receive, basically, if she'd seen a hospice provider, she would have been able to receive grief counseling for 13 months after his death. But now she's beyond that. But I might suggest that they reach out to hospice to see if they offer grief counseling groups that she might have access to. And I don't know exactly what that would look like, but if that would be supportive. But there was a comment in there about spiritual support. If she has some kind of connection. It doesn't say any kind of affiliation in the chart about religious or spiritual affiliation. And I kind of agree. I'm going to chime with what Alexis said. I think her dog could be a great motivation, provided that she feels safe handling the dog in terms of getting more activity. But Laura, I'm kind of wondering if you, Laura Stebbins, if you're still on, if you have suggestions for engaging people that have that they're experiencing depression and and finding motivation. I mean, do you think you have good suggestions in that area?
Um, yeah, thanks, Justin. So, I mean, I just want to say I sort of agree with what all's been said. I don't, if this person were referred to me for increased mobility, I would want their blood sugar to be much better controlled before we started structured exercise. But I think it's really individualized. So I think that, as a physical therapist, people ask us all the time, what's the best exercise? And the answer is truly individual. It's the exercise that you enjoy is the exercise that you're going to be more likely to do. But I think when people are so far removed from it, my best approach is really to just have them start really, really small, right? So, I think we all tend to say, oh, it's January, I'm going to go to the gym for an hour every single day, and it's like, just go for a 5-minute walk and try to do that every day. And if you can get some consistency and some success with that, then build from there. But I think with the depression, it's a lot easier to start very small and see some early wins and then build on those wins. I think it actually works against us if we make really big goals, because that's going to worsen the depression, because we're more likely to fail. And then there's the shame and the beating yourself up. And so that's usually my sort of recommendation that we have a lot of success with our patients using. So.
Thank you. All right, I think there's several other comments in the chat. Let's see. We're sorry, there's a few folks that are having audio problems. Deborah and Lynn, if you want to hang out after this session, we'll see if we can get that going. We don't know if this is a one-time issue or.
Mine is fixed now, thank you.
Oh, good. Okay, great. Thanks for letting us know that. All right, so Alexis suggested trying meal deliveries. Some offer healthy alternatives and making cooking simple with not a lot of ingredients. That's my jam. Let's see. Tiffany, would you like to jump on and say your comment?
Yeah, there
Awesome.
were a few. I was around the time the last comment came up, I was
You're entering it.
I was finishing
Yeah.
the comment
Yeah. So it
about
looks like
that
both of you.
same thing. It sounds as if she's not financially eligible for like anything like Meals on Wheels or anything, but depending on her budget, that would be a good idea, something for her to consider. Something else, another thought just popped into my head. I'm wondering, because she moved in order to be closer to her sisters, I'm wondering how often do they get together maybe for family meals? That might be something that she could do, to encourage her sisters, is like, hey, let's just meet at one of our houses and we all get together and we, cook together, or we contribute something, we each bring something, a potluck or whatever, and sit and have that time to get, to catch up. I did also notice that I believe her sisters are hearing impaired. So I'm not for certain how well she is, probably, she may have some grasp as far as sign language is concerned, but she wants to be able to strengthen that and strengthen those connections. That may be a way that she could actually do it as well. Another thing, simply because, and I'm kind of biased to this, but if she's not necessarily wanting to go out, I know that if she don't already have one, she could get one for cheap on Facebook Marketplace or something. But I found that rebounding, just kind of walking on a mini trampoline is really, really good exercise. At least it's a low impact situation. So she doesn't have to jump and be at least starting out, but just being able to move her legs and getting that resistance, that may be something good for her to start out with or whatever until she's able. And it also will help with her balance if she's having any balance issues as well. I have a rebounder, a mini trampoline in my bedroom. I keep it. And, you know, particularly on some Wednesdays when we're doing Wednesday workshop at, you know, for Trager, I'll stop in between sessions when we have a break, go in my bedroom, pull it down, and then start jumping up and down just so I can get some, just so I can get the juices going for about 5 minutes before I have to sit down for another meeting. But that's just me, based on there's some research that says that it's a pretty optimal way for exercise as far as that mini trampoline is concerned. So that may very well be, you know, and of course, somebody already said, you know, if she could get with her sisters, maybe they decide on a YouTube video and everybody gets together one morning or something along that line for 15 minutes or something, and they all watch the video and they all exercise, whether it's chair yoga or rebounding or something else along Tai Chi or something along that line. So that's something.
All right. Thank you, Tiffany. And I think in the chat, there's a variety of grief suggestions, grief group suggestion, parental grief group suggestion. There's grief share. I don't think I'm familiar with that. Did I miss that while I was reading other comments? Did someone else talk about grief share? Is that the name of a resource?
That's a religious grief support group. Some churches offer it.
Ah, okay. And then there was Camberwell Grief Source. Alexis, would you want to jump on and tell us about that one?
They're another program that they have a retreat center, and then they offer groups, and then they offer programming throughout the year.
Okay. Okay. All right. Any final comments before we close this portion of our session?
If anyone has any resources from me in the county that I am in Kentucky, 42262 is the zip code. I really appreciate that because, you know, we deal with mental patients, depression every single day. And the one resource that we have, you know, people go there and they say that they were never helped. They don't get anything out of it. So if anybody can share any with me, please put it in the chat and I'll copy it.
Deborah, you said 42262?
Yes.
And what part of the state is that?
Kentucky. That's Hopkinsville, Kentucky, Oak Grove, Kentucky. That's Christian County.
Okay.
Mm-hmm. If you could send me something, I would appreciate that because we only have like one place and everybody goes to the same place and it's the same, you know, it's the same thing all the time. I like different resources if you can.
Mm-hmm. Well, there's a lot of, at the Trager Institute, there's a variety of things that you can get via telehealth. You can get work with, licensed clinical social workers, CSWs, or students that are advanced level care, like social workers, couples and marriage family therapists, folks that, could provide telehealth. So it depends on if the individual actually has access to receive that telehealth via a secure line. But we also have caregiver groups. So a lot of folks, a lot of the organizations actually have a variety of resources they can offer through telehealth options. So I don't know if your particular patients or have access to Wi-Fi that you're thinking of, but we can share a variety of things in that space. I think Mona's also probably going to go through a couple of projects that were also offered virtually. Maybe what we should do is, this is a great segue into that. All right, so thank you, everyone. Thank you, Justin, for presenting the case, and we're going to go on. Thank you, Kristen, for all of your the wonderful didactic, and everybody. We're going to move now to the Kentucky Coalition for Healthy Communities portion of our programming today. And I think Mona's going to take over.
Okay, so let's go on to the next slide, Justin. Our purpose is to train and empower stakeholders and community members to provide hope and education for their communities, which we briefly mentioned earlier. And so let me go on and be able to share some of that with you. But first, before we do that, I'd just like to have a moment, if we could, share together. What are some things that you may have learned today, and how will you share this information? Because the idea of our echo is that we are consuming this information, but if we leave it right here and don't spread it out, then it's really not going to be a lot of good. So one of the things with the KCHC is we want to make sure that all this stuff gets out to our state. So I think that our person that just spoke, and I'm sorry if I don't refer to names, because right now I can't see. So you're a blur to me, and I certainly don't see the letters. But she was sharing a little bit of what I'm wanting us to share. What's going on in your community? What did you learn? And how are you going to be able to share that? So just unmute and speak up.
Hey, Mona, are you asking for people to what we learned today?
And how will you share it?
Okay. Oh, well, I will share it as a social work intern at the Trager Institute. I will definitely share it with more of my clients. The one thing that I learned that I, never really take it. They say physical activity is good, helps prevent disease and so forth and so on. But I didn't, for whatever reason, the connection was never made that a more sedentary lifestyle increases your risk for things like diabetes and heart disease and that type of thing. And as someone who just found out that they are like on the edge of pre-diabetes, yeah, I got to get my tail in gear. But yeah, that was something I hear, and I'll be passing that along to my to the people that I work with. So
thank you. That's a real important concept, because so often we think of the things that we're doing just to better ourselves for looks and those kind of things, not thinking about the really deep down health benefits of doing these things. So thank you for bringing that out. Anyone else?
I'll share. For me, this is Cynthia. It really resonated with me as far as when the first presenter mentioned it's just not enough, working out in the morning and say, okay, I did my work for the day and I'm just gonna sit all day and that's it. So it was interesting to know, hey, at least every 30 minutes get up and stretch and do something. And I'm gonna share that with my community, the Marines, because a lot of times, sure, we'll walk from here to there, but a lot of times it's just not as, I guess we're not moving enough. And now there's data behind it. So, anytime you can come with statistics then, and that's always a good thing. So that really resonated with me. And that's something I like to share with my Marines. So, thank you.
Yes, thank you so much. And those of us that have to sit at the computer so much, we have to be very intentional about getting up and stretching. Like we've been here an hour and a half. Technically, we should have gotten up a couple times and stretched. So let's think about that. All righty, so let's go on to the next slide, Justin. So I want to give the communities, and I know that we've got several communities, a chance to share your events. And also, if you have something going on in your community that is concerning you and you don't know what to do about it, please share that with us and we'll see what resources we can come up with. So I want to give a few more minutes for community conversation. And one thing I would say before I open it up, if you have something going on in your community, if you will send that to Justin before the meeting, we will make sure that we put your flyer on here, just as you'll see a couple of mine in a few moments. So has anyone got anything going on in their community that they'd like to share as far as an event or a concern? And I think we've heard one of the concerns already, and we'll be able to help with that.
I just, I wanted to say it's not really about my community specifically. I'm a remote student and I'll be working remote with Trager Institute. So I want to say that I love all of these collaboration sessions just so I can begin to learn about some of the resources and things that are available in the community of the people that I'll be working with. So I just think this is great that we have these sessions where we can share resources and ideas.
Yes, and it's so very helpful. And if you share that with your collaborative partners that this is going on, when you get into your work, then more people will learn about it. So we always want to share. We always want to collaborate. Okay, has anyone got any?
So I want to share two things. The first, and I just put my name and email address in the chat. I've been working with Age Friendly Louisville, and we are looking for community meetings to join in Jefferson County to talk about the Village movement. It is a national network of communities that are providing support for older adults that age in place, and we're looking for community meetings to speak at, just to basically generate information and engagement around this idea. We're looking for potential stakeholders, both organizations and the who would want to engage. So if you ever have any questions about the Village movement, and I will put that in the chat, please reach out to me. We would love to talk to you if you are in Louisville. And the other thing, and I'll report on this next month, we're going to be doing some virtual education around advanced care planning over the next couple of months. And one of our community partners has offered to provide continuing education for nurses and social workers. And so I will be following up probably in February and March with some community events where we'll be offering some education around advanced care planning.
Okay, thank you. Anyone else?
Justin,
Okay.
is there a flyer for the Village movement?
Bev, please email me. And I don't have a flyer per se, but I do have a lot of information, and I could kind of CC you into a conversation if you have some ideas or suggestions of people we should engage.
So I don't know if you can hear me, my earbud just went, but I have this large group of community health workers that I communicate with, and I could share simple information with them and make you a contact person if you would want me to do that.
I'll respond in the chat, Bev. Thank you.
Mm-hmm.
Okay. Anyone else? This is good. Learn what each other's doing. All righty, so let's go on to the next one. And I want to apologize right away because our facilitator training has been changed to the dates, and I had forgotten that when I did this template. But we are going to be doing our facilitator training on January 27th and February 3rd. So what's this all about? Well, this is part of our goal to help our communities become healthier throughout the state. We do a Flourishing Together class, and as you can see, we've got one started pretty soon, February 6th. And within that class, it's a 10-week class, and we do all these things that we've been talking about to become healthier from a holistic standpoint. We learn how to eat healthier. We learn how to look at food as medicine and what it can do to help us, just as kind of like with the walking. We know what happens if we eat poor things, but we don't always know the effects of the good things. So we want to bring that out. We'll do the same thing with activity and just help us be able to take control of our health conditions. We're going to learn a healthier lifestyle to prevent and manage diabetes, heart disease, and other chronic diseases. So that's the class, but there's very few facilitators, and we're wanting to spread it to the state. So if you look at that and you think, wow, that's something I'd like to be a part of, and I would like to learn how to be a leader, how to be a facilitator, please contact me. One of the first things we want you to do, though, is to take a class and make sure it's what you would think that it is and that you're interested in doing it. There's no charge for the training. There's no charge for taking the classes. That's one of the things we are so thankful, since we're able to work under a grant, that we can offer this to our communities. So if you have an interest, obviously you see a way there to contact us, or if you want to talk to me directly, you can let me know that, and Justin will give you my information to be able to talk to me.
And Mona,
Another
can we
thing-
ask you a question about the Flourishing Together class on February 6th through April 10th? Is that a virtual class?
Yes, everything that I do now is virtual.
Thank you.
I've
So
been
anyone across
grounded.
the state could join.
Pardon me?
So anyone across the state could join.
Anyone, anywhere can join.
There you go.
I've had them from a lot of different states, even Canada.
Great.
We want everyone to get healthy. We don't care where you're from, but obviously we do want to see our beloved state of Kentucky become healthier. I've always said, and I know some of you people hear me talk, probably tired of hearing it, but what I say is that Kentucky is better than that, and we do not need to be at the bottom end of all the outcomes. We got to learn how to become healthier.
Mona, can I stop you just for a second?
Yes.
Did you say the new dates are January 27th and February 3rd?
It's the last Monday, yeah, January 27th, and the first Monday. We changed them to Mondays because we had
What are the dates? I'm sorry, I don't know what that first Monday is. That the 3rd?
Yes, it is.
Okay, and then Mohammed, the Flourishing Together is through Zoom, but it is not through the Project Echo platform. It's through a different Zoom link. So I'll put my email address in there again. You can email me, and I'll make sure you have the contact information.
Yeah. I'll be glad to send him a flyer and the whole works, so just let me know what you need. Okay, we're also going to be starting on January 22nd, which is this coming Wednesday, a diabetes management class. And that's also virtual. And it is 7:30 to 9. I don't know why the time is wrong. I did something wrong, because it is a 2.5-hour class for 6 weeks. So if you're interested in that, again, you will get all this information from Justin, and let him know, and he can let me know. Or I can actually put my name and phone number in the chat before we leave. Okay, so other things go back a little bit. The other things that we have at Trager Institute is our Flourish program, and that's basically how our case study comes about, because we are designed to help adults with multiple chronic conditions to improve life satisfaction. And we do that through this comprehensive care navigation program, which includes very many collaborative people, but also our practicum students. We also have a caregiver program, and that's designed for folks that are taking care of someone that are 60 and above. And then we have our virtual friendly visitor program. And that is for people who are feeling lonely or isolated, and we can do these virtual visits with them to help them with that. So any of these things that you may be interested in, you can let Justin know, and he will make sure the correct people get the information. Okay, so go on to our next one, Justin. So another program that we do every Monday night is called My Health Matters, and So Does Yours. And actually, this program started way back in 2010 as a face-to-face once a month. And then once COVID became such a downer for us, and we had to be doing things all by Zoom, we started doing it by Zoom. I assumed that once COVID was over with, we might go to once a month in person and once a month virtual. But our people that come to this just have asked us to continue doing it on a weekly basis. So we've been doing it on a weekly basis since March of 20. We also do on occasion what I call open conversations. And when we do that, this last one we did, I asked the folks that were there, if you could design a class for My Health Matters, what would it be? And it was overwhelmingly, we talked about all aspects of end-of-life planning. And so we have a long series of end-of-life planning actually going through the first or second week in March. So, of course, this Monday, we're going to be respecting and honor Martin Luther King, and we will not have a meeting. January 27th, Peace Through Planning. And we have a person coming from a funeral home that will be talking to us about the benefits of pre-planning. And some people still have a hard time thinking about that, but I try to encourage any of the aging folks that I work with that that is the greatest gift that you can leave your loved ones, for them to know and understand what you want. February 3rd, we had so many questions about what's the difference between the nursing homes and all of these kind of things. And so we've got two folks from the Senior Lifestyle Management who's going to come and talk to us about that. February 10th, again, same questions. What's the difference between hospice and palliative care? And when should we do it and all these kind of things? So we've got a hospitalist coming from hospice here in Louisville to speak to us. On February 17th, we have estate recovery. And then February 24th, my person just responded and we got that one ready too. So as you can see, we got some really great classes coming. We meet for 1 hour. We try to start pretty quickly at 6:30 and we are out by 7:30. So if you can join us, we'd love to have you. And if you could share with others, you can do that as well. Okay, next one. So you've heard a little bit about Walk with the Doc. Well, I am fortunate enough to be able to do Walk with the Doc in Henry County at our park. And we do that the first Saturday of every month, except when we're iced in. Now, the person who is in charge of Walk with the Doc, who originated it almost 20 years ago now, the comment that came out probably early November is there's no such thing as bad weather. It's just bad clothing. But I don't think he lives in an ice area. So even though sometimes we'll use a little bit of 30 or 35 degree weather as excuse not to walk, let us remember if our sidewalks are clear and it's safe, we can just put a mask on and maybe an extra layer of clothing, because it's good for us to have some sunshine and to be out in the nature when possible. However, we know that's not always possible. And I think Kristen did a very adequate job of helping you know other ways to move even when you can't get out and walk. And I really want to encourage you to look up the 100 reasons to walk that was written by this doctor, because under each reason there is a link to the actual research to show that. And when I saw it, it was just amazing to me. We know that walking is one of the best things you can do for your overall health. But of course, we do want folks that have not moved at all who to get their doctors okay. And many diseases, conditions, and ailments can be prevented or even healed by participating in physical activity. So that's why we talk about that so much. Let's go on to the next slide. All righty, so before we do our closing pledge, I just want to say to you, we are starting a diabetes class this coming Wednesday night. I have room for a couple more people if you're interested. So if you're interested, please get a hold of us right away so that we can secure your place on that. Our closing pledge for the Kentucky Community for Healthy, our Kentucky Coalition for Healthy Communities is we will become an effective state coalition, working with community members and community-based organizations to empower our state to become a healthier and compassionate people. Therefore, we have some responsibility, folks, and we need to practice self-care and model healthy behaviors to our families, our coworkers, and members of our community. Thank you so much, and I'll yield it back to whoever's going to take over.